Yes, let's talk about that lady who had the facelift in Guadalajara, because yes, she indeed looks great, but there's a few things to consider if you are trying to sign up for that same doctor. So first of all, remember this is an early post-op, so pretty much everybody after a facelift looks good at first, right? Their skin is swollen, which makes the wrinkles go away. They don't have any recurrent laxity. Everything's really tight. There's no funny scarring. This is the time where most people look good. So you cannot judge surgical results for this surgery after a few weeks. So you need to see people many months out. Also remember, this is a massive weight loss patient and she's not really old. So this is the type of patient that has more of a wow result. So this would be an expected result from a facelift in this type of patient. So she looks great. I'm super happy for her. I hope it continues to heal really well. But I have to go through the things which freak me out a little bit about this patient and why I want people to be really careful before signing up for surgery out of the country. So the first thing is she did a video where she talked about why she chose this surgeon. She had some additional procedures done in Tijuana because she's a massive weight loss patient prior. And she talks about why she chose this particular surgeon for her facelift. And nowhere in that video did she mention vetting their credentials. I am a big advocate of people going to well-trained people. And when you are not from a country, you have a hard time doing this. I don't know how to vet credentials for people in other countries. And I am a surgeon. The system is very different, and navigating this as a layperson is even harder. So that worries me. The next thing is she said in a video that she had her pre-op evaluation right before surgery down there. That's not how it should ever happen. So your pre-op should always happen by an uninterested party, someone who's not part of their little system invested in you having a procedure, and it should always be done several weeks in advance. The reason why is because we often find things that need to be dealt with. So when we're doing your optimization, we may need to do certain things to get you as healthy and safe as possible for surgery. If you are flying down there having this done the day before surgery, it is much more likely those things will not be done. So from a safety standpoint, it's always safest to have your preoperative evaluation done by doctors that know you and have time to manage any potential problems so that you're safe. And then finally, this is a great example of someone who went to another country, had surgery, came back very quickly, and didn't have any problems. But there are many patients that do have problems. And when you're in this situation, it's very complicated to get care when you've had surgery in another country. So people always will tell me in my comments, my doctor calls me all the time. Calls do not replace examining you in person and being physically present for your patients if they have complications. You are giving up that part of your doctor-patient relationship when you have surgery out of the country. The other problem is that it is quite difficult to find a surgeon that is willing to care for complications from another surgeon. And if you do, it is often very expensive. So what we see is patients that have surgery out of the country don't have things taken care of, minor complications become major complications, and they end up in our ERs with absolutely horrific problems. In Cedars, in the last week, there's been 2 implant infections from people that have had surgery overseas. And implant infections are pretty rare, and often when minor things are caught early, it can be avoided. So these patients had complications that could have possibly been avoided and are more serious than they should have because they didn't have good follow-up care. And yes, good follow-up care means in-person care. So again, it's fun seeing cool plastic surgery results online. I love seeing great surgeons in different countries. There's wonderful plastic surgeons all over the world. But again, I just always want to make sure people are making safe decisions. A beautiful surgical result in one patient doesn't mean that's a safe surgeon for you to go to.